Hello, my name is Patricia LaBrosse, and I am the chairperson for the Louisiana Nurses Political Action Committee. We are conducting interviews with candidates for the seats in our state legislature for the 2023 election. We want to learn more about the candidates, where they stand on issues that are important to the welfare of our citizens and to our nursing profession. We solicited input from nurses around the state to find out what topics they were interested in, what they had their passions about. And we synthesized all of that down into 6 items for questionnaire, which we sent out to every person who was running for either the House of Representatives or for the state Senate. So I'm delighted at this point to be welcoming Mr. Stephen Whitlow, and he is a candidate from the 65th District for the House of Representatives. And I'm going to ask him, and that's Central, the city of Central Louisiana. I'm going to ask him to please give us a little bit more insight into the actual geographic area, because we don't want to confuse it with the whole geographic Central Louisiana that people think of, like Alexandria, et cetera, et cetera. So now I'm going to turn it over to Mr. Whitlow. I will be asking, he'll introduce himself. I will then be asking each of the questions to which he responded in his interview, and he will read his responses, and then we'll do a couple-minute close up for him. So I'm going to turn it over now to candidate Stephen Whitlow. Thank you for being with us.
Of course. Thank you for having me. I appreciate it. So I'm Steve Whitlow. I am the husband of Sharon and the father of 3 kids. I have a 26-year-old daughter who's married and currently in med school, and is completing her rotational trainings and will be graduating in May. And then we have a 23-year-old son who's on the autism spectrum and still lives with us. And then we have a 17-year-old son, Jackson, who's in high school and will graduate this year. And so we've lived in the area for a number of years. We are members of our church there in Central St. Alphonsus, and have been really active participants there. And both of my wife and I are practicing attorneys, but several years ago, we started a nonprofit called Gateway Transition Center, which helps young adults with autism transition from high school age into adult living. And we also had a t-shirt shop associated with that called Gateway Inc., where they would go in, they would learn how to have a job, they'd learn the skills necessary to work on their own. And so we began doing that. It was so successful that it was taken over by a national nonprofit. And I no longer do that. We went to work with my wife so that we can make this run for the legislature. But our district itself is the city of Central. It runs from roughly Blackwater Road up through almost to Zachary. There's a road, Highway 64, Deerford Road, that goes across the top of our district, all the way over to a road called Greenwell Springs, which runs along the Amite River. And that road goes all the way down to where it intersects with the Central Thruway, goes down to O'Neill Lane to basically the interstate. It goes a little beyond the interstate in O'Neill, but it goes across to Millerville, up Millerville to where it starts to follow the Comite again back up to Blackwater Road. So it's mostly comprised of Central. It does have some other geographic areas. Up to the north, it's fairly rural. Down in the south, it's Millerville and O'Neill, so it's a little bit more of a suburban environment, but it's a wonderful district. I'm happy to be living there for so many years, and we've loved raising our kids there.
Well, thank you. All right, we will now move into the questions. And as I said, I'll ask the question, and Mr. Whitlow will give us the responses that he put on the questionnaire that he returned to us. So question number 1 is regarding healthcare disparities. Prior to the pandemic, the COVID pandemic, we recognize that health services are not accessible equitably across the United States and in Louisiana. Healthcare is only 20% of what accounts for our health status, and the social determinants of health are the non-medical factors that influence our health outcomes. What strategies do you have to assist with reducing the social determinant of health's impact on the citizens of Louisiana?
Diseases of despair are more prevalent than ever. Louisiana's family, education, and economic environment do not foster well-being among children and adults in our state. Research has shown that individuals who come from nuclear families, complete high school, and are gainfully employed are more likely to be economically successful and live healthier lives. I would focus on policies which promote families staying together and improve our educational opportunities for our children. Also, individuals who are actively engaged in faith are healthier and less prone to mental difficulties. While the state obviously cannot establish or promote religious experiences, it can foster opportunities for faith-based organizations to involve themselves in the needs of the community.
Thank you. The next question has to do with nursing education faculty shortage. How would you advocate for federal and state funding to support the recruitment and retention of nursing faculty to reduce our nursing shortage?
I would encourage our high schools to partner with universities and colleges to expose students to opportunities available in the healthcare industry. Our local high school is a program called Wildcat College, which partners with BRCC to provide associate level classes to select students in the high school. Students are enrolled in classes which give college credit, but also expose students to opportunities available after high school. So I think this would be a good opportunity for nursing students to be exposed to the industry and explore educational opportunities in the nursing field.
And for the purposes of clarification, I want to let our viewers know that BRCC is Baton Rouge Community College, correct?
That is correct, and I apologize. And I would
That's
really,
okay.
I would really think this would be an excellent opportunity for pilot programs across the state, because we have school districts that can partner with local, local agencies to identify the specific areas that are really in need in those particular regions. So not just to answer in terms of our region, but this can be expanded throughout the state.
Thank you. The next question is on safety and violence. Gun violence continues to roar through our communities, in our schools, in our houses of worship, shopping malls, grocery stores, outdoor gatherings, et cetera, et cetera, et cetera. What factors do you see as critical to bringing an end to these senseless acts, and do you have a strategy to address the problem?
Public safety as a whole has suffered in Louisiana in recent years. I support increased policing to ensure that our streets are safe. At the same time, our state should encourage programs which improve the social determinants of health discussed in the first paragraph. Drug use, gun violence, and other crimes are symptoms of the decline in hope and the social determinants that lead people to despair. The state does not have the capacity to change the trajectory of communities, neighborhoods, and individual lives. However, the state can encourage individual behaviors and facilitate programs that can be of extraordinary benefit. We must be honest and be research-based in promoting solutions to the underlying societal issues leading to increased violence and drug use.
Thank you. The next question, access to care. Are you supportive of actions to remove arbitrary barriers which prevent all healthcare practitioners, including advanced practice registered nurses, from practicing to the full extent of their education, licensure, and training?
Well, I'll answer the question, but I also want to provide a caveat. I am not from the healthcare industry, and so I want to make sure that folks understand I don't know the nuances of these provisions and what they would require. So I answered this question with regard to my general philosophies in terms of what should be advanced. And I look forward to hearing from the Nursing Association to figure out what are the best solutions with regard to this. My answer was, I support the free exercise for all practitioners within the scope of their education experience. I can envision an increase in autonomy, reducing the overall cost of healthcare and providing greater access for patients. Of course, patient health is of paramount concern. I'm generally concerned about the increasing government intervention and bureaucracy in the practice of medicine and other places. I would require additional information to understand how authority for healthcare could be effectively split between the medical and nursing boards without creating inconsistent standards and increased administrative burden within our system.
Thank you. The last two questions are pretty much general. What are your legislative priorities?
I will prioritize an effective and accountable government. Louisiana has squandered its natural, economic, and educational resources through ineffective and unaccountable policies. As a result, we have communities and individuals without hope and opportunities. Many of these issues discussed above arise from the failed government policies. Healthcare is an industry that has suffered along with the general economy. A decrease in insured patients reduced in reimbursement rates from Medicaid and other insurance providers, and the decrease in general overall health all place stress on nurses and other healthcare providers. I intend to spearhead policies that will improve the general overall economic, educational, and societal environment of our state.
Thank you. Final question before you have the opportunity for your wrap up. Why should the Louisiana nursing community support you as the best candidate for this legislative seat that you're seeking?
Our son is on the autism spectrum and grew up with various physical and mental health issues. We've come to appreciate the substantial benefits of good healthcare providers, and I'm dedicated to improving the opportunities and experiences of nurses by general economic and educational priorities.
All right, so now I'll ask you for a couple minutes to just a general wrap up that you would like to share.
So thank you for that. I appreciate the opportunity to speak with everyone today. The reason why I'm involved, I can tell I've got some gray hair. I have not been in politics before, and so I've lived a life before politics. But the reality of it is, as my wife and I were discussing the issues that face Louisiana, there didn't seem to be any real commitment to improve the overall financial, economic, healthcare condition, the educational condition of the state. We seem to be poking around the edges instead of getting to the core issues that need to be addressed. There are only 3 states in the United States that have a decline in their gross domestic product. And there's only 5 states that have lost population over the past 10 years, from 2012 to 2022. Louisiana was one of those. And the only way that we can solve the problems that exist for nurses and exist in the healthcare industry and exist for education is if we take these issues and address them head on. And so what my wife and I are just really dedicated to doing is to go back, have the government do the fundamental things that it needs to do in terms of its infrastructure, its education, its public safety, and its business environment, so that we can then have a healthy economy that will allow us to solve these other problems. I've been told as we started to run that you can't deal with the big issues, that those things can't be addressed. But the reality of it is, if we don't, then our environment, business environment will continue to decline. I have a son who's in high school who doesn't want to stay in Louisiana. And why would I convince him to stay here if he's going to be facing a declining economy throughout his professional life? So what we're dedicated to doing is to improve the lives of our citizens by improving the economic and educational infrastructure and public safety systems, so that citizens then can determine their own fate. We can provide the healthcare that people need. We can give nurses a good chance to live the lives that they intend to lead and to serve the public that they wish to serve.
Well, thank you. Thank you very much. Thank you again for your time out of your very busy schedule. And we want to wish you good luck with the continuation of your campaign. Thank you.
Thank you as well. I appreciate the opportunity.